Hey everyone, welcome to MyoLab. My name is Dr. Evan Schwindt. Thanks for tuning in. Kevin, let's get down to work. Today we're going to work on hip centration. Hip centration is critical in helping out with low back, hip, and also knee pain, especially if it's due to your hips being malaligned. The importance of hip centration really comes down to keeping the hip centered while moving your leg in space. The hip is most powerful when it's in its socket centrally. So what we want to do, make sure we first start off in a nice neutral position, like a plank, a flat board. Oftentimes when we get in this position, I see patients actually think they're straight when they're pushed backwards like so. We're not trying to get into an athletic stance, a squat, deadlift, nothing like that. For this case, we are focusing on stabilizing the hip in as neutral or centered position as possible. Now to begin, it's nice to utilize some assistance like a dowel, a broomstick, a countertop, a foam roller to help yourself with some balance. So we start off with a little bit of extension through the hips, keeping us nice and straight. For this one, we're going to demonstrate hip centration of your left hip. Slowly bring the right hip up for phase one of this exercise. You're going to notice this challenges your balance substantially, and as long as you are not twisting either way, this will be a smooth movement forward. Your knee will not be hitting the ground as you go forward, okay? Once we're able to progress past that, if we're feeling as though we can bring this opposite leg up and down without losing substantial balance, we can progress it into straightening that leg out, tapping the heel, bringing it back down to neutral. Again, all the work is really happening here. Trying to balance yourself and stay as stable as possible. The last phase of this before we remove the stick is going to be go forward and then go back as far as you can. That's one rep. Forward, back as far as you can, one rep. I'll demonstrate from the front here as well. We want to make sure we have minimal lateral shift. Activate the core, activate the glutes, come forward, touch down, go back as far as you can. Keep that hip stable. Then eventually we'll remove the stick and continue on accordingly. Touch forward, slowly back down. Touch forward, slowly back down. You're going to do this to technical failure. We're working on muscular endurance when we're talking about hip centration. So we're not doing a certain number of sets or reps. Do this until you fail. Failure is going to be a bunch of shifting. Inability to raise your leg because you keep hitting the ground because you're also falling into it. Or just simply losing your balance in general. If you have any pain at any point through the knee from the pressure on the ground, please do this on a towel, a cushion, anything like that. The softer surface will make it more difficult, so please use balance initially. Kevin and I want to take this time to personally thank you for watching today's video. Now, if you're in the Calgary, Alberta area, please be sure to check us out at myolab.ca where you can book online 24/7. We also direct bill to over 20 insurance providers for your convenience. We have a fantastic team here to help you out through any of your needs. If you have any questions from today's video, please be sure to leave a comment down below. If you like what you saw today, please be sure to smash that like button and share with any of your friends. Please also be sure to hit that subscribe button and follow us for our next video. You might see some other videos to the sides today that might benefit you as well. Lastly, please be sure to follow us on Instagram at MyoLabYYC. Take care.